Dental sealants are one of those things that have been around for a long time, ADA approved, pretty much available in just about every office, except mine. And there's a reason for that. Sealants are overdone. And if I look at how many times I'm doing a filling on a kid, on an adult tooth, it's so infrequent. So what would the sealants do? If I'm not doing any fillings and I don't see that many cavities on kids, what would the sealants really be preventing if there's already no decay? It's not going to help much because there's nothing to prevent against. There are certainly public health circumstances where sealants on a bulk majority of kids that don't really have much parental direction at home, nobody really telling them to brush their teeth, I can certainly imagine where sealants might be beneficial. But sealants are, although ADA supported, you have to decide as a general practitioner, and I hope all general practitioners go through this, the mental gymnastics for this. Are sealants going to be effective with my patient population, with my patients? When I evaluate this particular practice after I've been here for 20 years, I don't find them to be helpful at all. As a matter of fact, if they're not done correctly, which I see all the time from other offices, they leak and they trap decay sometimes underneath, and those are the only teeth that have decay, or those teeth that have sealants on them. All the rest of the teeth are fine. So they actually went backwards using the sealant. And someone can say, well, gee, if there's fluoride release, dentists talk about this fluoride release all the time. Yeah, but if it's already trapped decay and that fluoride's not going to do anything, there's decay already there, there's bacteria already, it's leaking. Fluoride's not going to help erase that. So sealants, don't jump onto sealants, all of you patients out there, just because your dentist says to, because it's not that automatic. It is really not that great of a service to provide unless it's done in a very special way, which I could get into in another video. But if the hygienists are placing it, chances are it's not really being done correctly.